Here's today's Genesis Medical Moments.
We are continuing our conversation on breast reconstruction after cancer with Dr. Michael Yang of Genesis Plastic Surgery. So, Dr. Yang, you spoke earlier about how a patient determines what's the best option for them. When is the best time for breast reconstruction? At the time of mastectomy or afterwards?
There's not really one right answer. A lot of the reconstruction, if possible, especially with implants, is done immediately while the woman is still on the operating table. So after the mastectomy is complete, then we're able to put in tissue expanders most of the time after surgery. But sometimes, either due to scheduling conflicts or wanting to the patient's own preference, it can be done at a later time. There's not really one right answer, but oftentimes for convenience sake and also to avoid having to have a separate surgery, we can do it at the same time.
Okay. And let's talk about recovery time. What are we looking at there? What are women looking at?
Sure. As we talked about before, there's the different types of reconstruction. So one is the implant-based and one is what's called autologous-based, which is using the woman's own tissues. Recovery after surgery for the implant-based is usually a lot faster just because it's a shorter surgery and we aren't making as extensive, it's not quite as extensive as surgery at one time, so the recovery period is shorter, the incisions are smaller as well. So if the woman decides to do reconstruction based on her own tissues, the surgery is typically a lot longer. And that's usually a whole day type of surgery, so it's a very long surgery, so the recovery is typically much more involved. The patient is usually admitted to the hospital for a number of days for monitoring afterwards, so the recovery time for that is significantly longer. But again, it depends on individual factors such as if there's any complications after surgery, how medically fit the patient was before surgery, if the patient's a smoker, all these things contribute to it, so it's very dependent on each patient.
Gotcha. Okay. So do some women decide not to have breast reconstruction?
They do, yes. Some women that, they just decide the cancer diagnosis was already a significant thing to deal with, and they already had to have, a mastectomy to take care of the cancer, and they just decide, I'm at this stage of my life where that's not really something I'm concerned about or worried about. It's not something that's important to me, and that's a perfectly valid thing as well. Reconstruction is a totally optional thing, so it's perfectly valid to decide that that's not something that a patient would want.
All right. Well, a big decision to make, definitely, for women, and that's why it's important to talk to a healthcare professional like yourself here at Genesis to help with that decision.
Yeah. It's after we talk about all the pros and cons of each one, then it's definitely a very individualized decision for each and every patient.
All right. Well, Dr. Yang, thank you so much for taking the time to talk to us today.
Thank you so much for having me.
And this was your Genesis Medical Moments. For more information, go to ourquadcities.com and click on the Medical tab.